The lower face filler techniques is quite important, especially in females with aging process where we get a lot of volume loss from bone and soft tissue in the lower face, especially the lower jawline. It is a very highly vascular area, and that is why the technique is recommended with a cannula. So here I'm using a 22 gauge 50 millimeter cannula, using it with an easy guide to help just for the entry point of the cannula, and then insert the cannula, remove the little easy guide, and then move into the subcutaneous tissue. So the level of injection is really the superficial fat compartment. You could also go deeper with a volumizing filler. I'm using a medium depth filler here to give some support to the jawline itself, and then especially just above the jawline as it dips down towards the alveolar height area. There we get a lot of volume loss because with aging we get loss of alveolar height. Also the depressor angularis and mentalis muscles has a negative impact on this specific area with dimpling in the area. So this is an ideal technique to do in patients, especially over the age of 40, 45 years old, or as soon as they start to show volume loss in this region. It's quite important to use a 22 gauge cannula because we don't want any vascular injuries. We don't want to risk that because there's a lot of connections and anastomosis. Just also moving again to the other side. So in total in this patient, I'm using 1.2 milliliters, so 0.6 per side. The more volume loss they have, or maybe even chin retrusion, you could go for higher volumes, and you can even go for more volumizing type of fillers. I'm using a cross-linked HA filler and fanning it very smoothly in this region. Afterwards you can do really good massaging, but usually with talking it settles in very nicely and integrates with the tissue. So this can be adapted according to each and individual patient to where they need specifically this treatment.